Welcome back everyone to the RT Clinic. Today's video is an instructional on why you should be using one of these when you have one of these. Let's go. Today we're going to talk a little bit about using an MDI and why you have to have a spacer when it comes to that. So we specifically know these are not cheap at all. And so we want to make sure that we're getting the most medication for our dollar. And the way to do that is with a spacer. Now, a lot of people, if you go to the pharmacy and you get an albuterol inhaler or whatever inhaler it is, you're probably not also going to have it paired with a spacer or a valve holding device. And I'll talk a little bit about that. So from a respiratory therapy side, this is such a key piece to making sure the medication gets all the way down to those lower airways where it needs to get to actually work. The medication that gets in your mouth, in your trachea, in your oral pharynx, anywhere down before it gets to those final branches of your airways is really no good. And standardly, with most people taking an MDI as they would without a spacer, even with really good technique without a spacer, which is usually the two-finger method in front of your mouth, mouth wide open, fully exhaling, inhaling, pressing the MDI at the exact right time, you're still only going to get about 20 to 30% of the medication. That's a very, very aggressive number. It's probably a lot less than that. So using a spacer with this or a valve holding chamber, what it does, it actually takes the medication that comes from the MDI, it goes inside of this holding chamber, and this will hold the medication. So when it's puffed, it will actually hold the medication inside of here. During that time, it suspends it in the air. It also dries it just a little bit, and it takes that aspect when that medication comes out, that blasting aspect. A lot of time what happens with those propellants is that really presses it in to the tissue of your mouth. And so then you get, it's not really going to the airways where it needs to open up. It's going just to your tissues, and if it deposits in that tissue, it doesn't work, and so you've lost medication. In this case, it's going to go into this tube, it's going to stay suspended in the air, it's going to dry it slightly because it's a drier area, and then what you're going to do is you're going to take a breath through this side of that medication suspended in the air. So this is why it increases it by 50% at least about the medication that's getting down to your lower airways to actually work. And you know, if you're buying medication, you don't want to be wasting it. You want, for each one of the puffs of this, you want it to work well. And so I'm actually going to link, if you look below, and I have no affiliate with this, but there are a few of these, really interesting enough, of these spacers that you can buy on Amazon, and they're less than $20. But think about the amount that you can actually save in medication costs if each one of these puffs is actually getting to where it needs to go. Now, the physician or provider, they're going to order so many puffs for you. Maybe it'll be 2 puffs every 4 hours as needed, or maybe it'll be 2 puffs every 8 hours. Make sure you know that. You cannot, with this device, give 2 puffs back to back like this. You have to do 1 puff and then take your slow breath in. And I'll go through that demonstration in just a second. But it's got to be 1 puff, slow breath in, breath hold 10 seconds is really, really important. It takes the medication all the way down to the bottom where it needs to go. If you breath hold, you don't immediately bring it back out, obviously. So it actually is going to bind to those muscles and loosen them up. Gets to right where it needs to go, right off the bat. So slow, deep breath in, breath hold 10 seconds, and then a slow exhalation. That's going to put the medication down to the lower airways, bind to those muscles, loosen them up, and open them up for you. And so those are 2 real important keys, that slow breath. A lot of times people will take a breath like this. That's actually very fast. there's a lot of swirling going on, a lot of turbulence going on when you take that breath in, which takes that suspended medication and just splatters it all over the place. Inside of your mouth, your upper airway, your trachea, all those areas. You want to think about when you take this breath in, the smooth flow. We call it laminar in respiratory therapy world. We call it's very smooth. It's very smooth coming in. So that medication suspended inside of here, we're going to smoothly take it all the way down to our lower airways, hold it in for 10 seconds, and then exhale it out. Usually you're going to wait about 30 seconds to 60 seconds between the next breath. If they ordered 2 puffs for you every so often, or 4 puffs, you got to wait in between each one of those. But this device here can really assist in getting medication to where it needs to go. A lot of people will have an inhaler, and I always like to ask them, is your inhaler working for you? Do you think it works? Well, a lot of them really have never been given a spacer to get the medication to where it needs to go. Because if you don't have a spacer, you're losing at least 50% or more, actually a lot more, of your medication in your airways that don't even matter. This has to get down to those lower bronchioles. So let me do a demonstration real quick of what a normal breath would look like with an MDI. And so this could work for anyone that has an MDI, meter dose inhaler, and they have a spacer like this. So initially, there's some different parts to this MDI, and this is just a test one. So it could be, you could have anything that's similar to this, albuterol or whatever. Breztri is this case, but the medication's inside of here, and right here is where the medication will be coming out, okay? So a lot of times these things have to be shaken. There is propellant inside of that. It goes inside this device right here. The cap comes off, and usually they say this is the mouthpiece. We do not put our mouth on this because that's not gonna do anything good when it comes to delivering medications. If you really want the medication to work, you need to use a spacer with it or a valved holding chamber. Now, what about valved holding chamber? It's valved because it's not, it actually has a valve inside of here. And I'm not sure if you can see it, almost like a duck bill. So when that medication goes in, it doesn't immediately go out this end. It's held inside of here with a one-way valve. The only way to activate the valve is your slow breath in. And so the valved holding chamber is even better. Now they do make spacers, sometimes they're cheaper, but it's essentially just a tube that kind of holds it. Valved holding chambers are really nice, especially if they're anti-static, because then if you buy those ones that are anti-static, they will not pull particles, because these are microscopic particles. They won't pull them and stick them to the sides if it's anti-static. So another little nice piece to it. But let's go through this whole piece of taking your medication. So we give it a shake. If you haven't taken it for a few days, sometimes it needs to be primed. So we would prime the medication by pressing it once. What priming does, for one, it wastes a puff, so you don't want to do it too much, but it actually fills this area right here so that the next time that you actuate this down, you're going to get medication. That area can dry up, and that's the problem. If that dries up, then the first time you press this, it just fills that plastic area. The second time you press it, it actually will come out. And so in this case, we've already primed it. We've inserted it into our valved holding chamber, and we're going to prepare ourselves to take the breath. So when we take this breath, you'll want to do a couple different things. The great thing about the spacer or the valve holding chamber is it actually takes a lot of the coordination out of it, because what you can do is you can actually actuate it out here, put it then in your mouth and take your breath in instead of the whole pushing and quickly breathing after. So let's watch how we do it. So we have to shake it. I'm going to fully exhale as much as I can out. Actuate this. Medication goes into this area right here. While I'm fully exhaled, place my lips upon this. Take my breath in slow. To full, and then I'm going to hold it for 10 seconds before I let it out. Now, you probably heard something interesting in there that I triggered when we did that. And what that was, if you heard the harmonica sound, let me do it again. You hear a harmonica sound. you should not hear the harmonica sound. And so that is one of the keys to these medications. It's actually built inside of this MDI because it's a trainer. But if you take your breath in very slow, you won't hear it. So you didn't hear it there, but if I take it in a little faster, that's too fast. So the harmonica sound, if you're taking your breath in, or if there's any kind of sound that comes from your valve holding chamber or your MDI, which most times that won't come from your MDI, your valve holding chamber, if you hear a sound that comes from it that's like a harmonica sound, that's telling you that your flow rate is too fast. And so it's great for training yourself because you can actually, and this one actually does do it. I could actually occlude this side, and this is a nice one from Monaghan, a nice valve holding chamber here from Monaghan, but what I can actually do is occlude this. You can see this has a harmonica piece on it. If I take it too fast, you can hear it, but if I take it very slow, you didn't. And so it is really good for training you to get that breath to go in slow. If you've been taking an MDI a long time in your life, you're probably just every time you do this, you're gonna automatically take that fast breath in. So it does take a lot of training, but it's extremely important because the medication can really get down to where it needs to go when it comes to delivering the medication down, delivering 50% more of it. And so that's why these are so important. So what you're going to do, these can be cleaned, very similar to the nebulizer. They can usually be taken apart. They can be washed and sometimes cleaned. Sometimes they're dishwasher safe. Sometimes they're not. Check the insert that comes with them when you do that. Like I said, check the link. I'll put the link in the description if you're interested in purchasing one. But if you have an MDI, this is something that you really need to be using because it helps the medication that you've spent your hard-earned dollars on get to where it needs to go so that maybe whenever you use it, it's more effective, especially in the case of a fast-acting bronchodilator, because we know you're gonna need those very, very quickly, and we need them to work quickly as well because you're having acute bronchospasm or bronchospasm that's happening right now, and you're very short of breath, and so we need that medication to get to the right place, not all in the mouth and the upper airway, down to the lower lungs as fast as we can so it can start working. Now, Buterol works very quickly. It works usually within 5 to 8 minutes after you do it. So that actually would start working very quickly, and it's made to do that because it's called a rescue inhaler. And so that's extremely important to have in mind. So like I said, back for a review, we have MDI. Anytime you have an MDI, you need to have some type of valve holding device. Okay, so linked below, you'll see that. These are extremely important. You can also have masks put on these for children. I would never give a child an MDI unless they had one of these with a mask because the mask will actually seal on their face. I hope you learned something today, and I hope you can better deliver your medications and get your money's worth out of these MDIs. There's good medication in here. It's expensive, but there are proper ways to use it. And I hope you do that in the future. And I'll see you later.